Welcome back to the Arizona Daily Mix. Coming up in March, we have a special live heart procedure that's going to be taking place here on AZTV 7, and it's going to be performed by Dr.Rizik, who's joining us. And leading up to that, we've been talking a little bit, and let's see, the first one we got to meet you. The second one we talked about Honor Health, who you're with. And today we're just kind of like talking a little more to make me feel comfortable, make other people feel comfortable out there who are looking to go into surgery, who are looking to, of course, how can I say, get medical treatment. And we're talking the vaccine. That's been on everybody's mind going into 2021. And I asked you, that I'm going to be in the operating room with you. And so I asked you about the vaccine. And I'm a little nervous about it, but you're like, Brad, let's get some of the myths and some of the things taken care of here, right?
Brad, let's get the message taken care of here. First of all, I think the question that we get asked the most is it safe? There's no question the vaccine is safe based on some very well done trials. Of course, the trials had to be sped up. These are both, if you think of the Pfizer and the Moderna vaccines, the two that are approved in the United States, they're both what we call mRNA vaccines. And the beauty about these vaccines is they can be developed very quickly. Vaccines can take years to develop, but these technologies that Pfizer and their partner used, as well as Moderna, we can get vaccines up and running very quickly. And remember, this is not going to be our last pandemic. And looking into the future, not only are these vaccines safe, but they can be developed in a matter of weeks and months.
Yeah.
So that's going to be important as we go into the future.
Yeah, and I want to make sure really quick, I said going into procedure, I'm not getting the heart done. You're going to be doing it on one of your patients there. I want to make sure that's clear. But we are talking about getting the vaccine if we're going into get something done. Because, you're hearing the myths, well, don't take it if you're going to be doing this or this and that. But you're saying, you guys have been checking this out. You've been doing the plan. You've been looking at all that.
We've watched, Honor Health has done a superb job of getting this vaccine out there to our healthcare workers, et cetera, and those at-risk patients. There have been few, if any, untoward side effects or complications. Few people had panic attacks when they were getting the vaccine, but very, very safe vaccine based on our experience at Honor Health and the studies that were performed over the course of 2020. So it's safe. The question we get asked the most is, well, what if I have fevers or chills? Is that a bad thing? And that's actually a good thing. It means that your immune response is positive. You're having an immune response to the vaccine, so you're kind of tweaking up your immunogenicity to the virus.
Yeah, we also want to break down the myth that, okay, you got the vaccine, doesn't mean you go around still without being cautious, still washing your hands, still being social distancing, still being respectful to other people who might not have gotten the vaccine yet, or of course just in general, right, when it comes to our health.
We use the word abundance of caution. And I would say the vaccine is one piece to the puzzle, but remaining appropriate with masks, hand washing. If you think about this year, we haven't seen much influenza. Everybody's wearing a mask and everybody's hand washing. So I would say maintain those practices.
I like that. All right, let's go talk about the procedure, because that is coming up here soon. And we talked again, if you missed these, we have them on AZTV.com on a special page. You have to check out our talks, because I talked about my dad, who was, I guess, like in the experimental time when they were doing these splints, stents. Sorry, I keep saying splints and stents. The stents.
It's kind of a splint, so you can use that.
There you go. And you're saying that now the technology and what you guys are using is really way different from back when my dad had it done.
It's slicker, it's smoother, it's easier to place. All of these procedures that we are doing have become really slick over the years. I was thinking, what would Brad like to see us do? And what we're going to do is a valve therapy. We're going to take a valve that is diseased, and we're either going to replace it or repair it without opening the chest. Historically, this is the domain of the surgeon who's going to do an open chest procedure. We're going to do it through a catheter in the thigh.
Wow. That is amazing. And like I said, I think about the chest being open and, you know, the heart beating in front of there, but this is all. Now, do you guys take a camera up through there? Is that what happens?
No, we do everything with an X-ray camera over the patient. So we're looking with X-ray through the patient's chest, and that's how we guide the catheter up to the heart. But we just put a small little catheter in the vein or artery of the leg and sort of snake it up to the, advance it to the heart. And we're going to have you in scrubs, and you're going to be standing right next to me doing this with us.
Is there going to be a... I'm sorry laughing, doctor, because what if I faint? That's going to be great TV, right? No, I probably won't.
They're going to be great. They're going to be great. But we'll have a chair next to you just in case.
Which is very funny. One reason we're showing this, and you guys want to do it, Honor Health and your staff, is because we want to do prevention. And if someone sees how this works and sees what you guys are working with, it might say, okay, you know what? I need to start being a little more health conscious with myself and my heart, so I don't have to have this procedure, but if I do, I'm going to be in good hands.
You want to be proactive and prevent disease. That's the most important therapies that we have for heart disease is proactive prevention. But if you do need one of these procedures, it's nice to be informed as to what your options are. And we talk all the time, we want our patients to understand their options.
All right, before we leave, got to give the shout out to Honor Health and your team.
Oh, my team is great. Honor Health is a fantastic, we have a fantastic program, a fantastic OR, a fantastic cardiac catheterization laboratory. We have a great interdisciplinary team. It's not a chore going to work, it's an absolute pleasure going to work every day.
I like it. And up on the screen right now is the date for the procedure, which will be taking place here on AZTV 7 Live. And if you really want to watch and see if I pass out, you're definitely going to want to watch the procedure. I won't. Well, I won't. I'll be okay, right?
Right.
Okay, doctor, you sure I'm not going to pass out?
You're not
sure?
going to pass out, I promise. But we'll have a chair for you just in case.
All right, thank you, doctor.